My wife Shelly was taking a boat ride on Perdido Bay last summer. As she was returning to the boat ramp in the evening, her adventure took a shocking detour. Shelly saw what she thought was a crab trap marker or a buoy in the water, but as she edged closer, she realized it was a woman. Shelly's first reaction to the situation was to be suspicious and cautious. She was alone in the boat and didn't know if she was being targeted or tricked in some way.
Then she looked more closely at the woman, who was barely able to keep her head above water. The woman did not have any clothes on. She seemed confused and impaired, and Shelly's emergency instincts kicked in, and she leaned over to pull her into the boat. Shelly used all of her strength to hoist the woman from the water, and then she gave her a towel and extra shirt that was on the boat. A storm was beginning to roll in, so the boat ride back to the ramp was choppy and shaky. The woman found was physically and mentally and emotionally exhausted.
Shelly called 911 to request emergency officials to arrive at the boat ramp, and she called me to tell me what was happening. At first, the woman did not share much with Shelly except to say that she needed to get to her family and she was ready for it all to end. Shelly stayed with her, talking and asking questions to learn more about the situation. Shelly mentioned local area resources and community programs that could help her.
Shelly does not know what happened to the lady after emergency officials arrived and took her away, but she affectionately refers to her as the mermaid in her life. She even sometimes wears a mermaid necklace in the woman's honor. Shelly does not consider what she did to be anything heroic or special, just saying I was in the right place at the right time and that all humans should help each other.
Although she may not consider herself a hero, Shelly definitely saved a life that day. Her selfless courage, compassion, and service to help a stranger during a very dark part of their journey make me a proud husband and Shelly a Baptist healthcare legend.
God calls us to serve others, and children who have experienced trauma are a special calling. Shalika Robinson is using that calling to offer her skills and talents to serve and provide compassionate care to children and families in foster care. Shalika has been with FFN for more than 7 years. Since her days as an intern, she began caring for and styling the hair of African American foster children. She also teaches foster parents how to care for the children's hair. 36% of the foster kids within FFN are Black, while only 16% of foster parents are Black. Therefore, there is a real opportunity for teaching those parents how to properly care for the children's hair. It's also an opportunity to meet the cultural identity needs of each child. After noticing this need and the big impact she was making, Shalika became a licensed hair stylist and braiding specialist. Her tender acts of hair care empower youth to see their hair as beautiful, no matter the length or style. Beyond the physical makeovers, Shalika's hair routines have helped brighten the spirits of the children. She takes the children shopping and lets them choose the hair products and style that they want. She may spend anywhere from 1 to 4 hours on each child's hair. As she styles hair, Shalika talks with each child, getting to know her or him. It becomes a real bonding experience. After the hair is done, Shalika says each child leaves feeling more encouraged and hopeful about the day. Often, these children become more open to their foster families or the possibility of adoption as a result. During one session, a teenage girl opened up to Shalika, saying she would now consider adoption and would be open to permanent placement with a forever family. Prior to that conversation, the young girl said she would rather age out of foster care than be adopted. Thanks to Shalika and their bonding, the foster teen gained trust. The girl volunteered something to Shalika that she may not have otherwise been confident enough to share. In addition to hair and self-esteem transformations she creates in children, Shalika also has volunteered twice for disaster relief. She went with FFN team members to the affected areas hit hard after Hurricane Irma in Miami and Hurricane Michael in Panama City. She said it was eye-opening to see the conditions that foster families were living in after the storms. She was honored to help support and provide comfort to these families. Shalika is committed to serving others and never considers caring for children's hair, teaching families, or volunteering for disaster relief as work. She believes it's the right thing and God's calling for her to do. Her ownership, integrity, and compassion make Shalika a Baptist healthcare legend.
In our hospital, our nurses and case managers are expected to care for patients. But trying to rescue and rehome a patient's cat is not in the job description. I'll now tell you about the great cat caper of 2019. It began in January when an elderly couple married for 57 years arrived at Baptist. This quickly became quite the adventure for Jean LeGrand, Vicki Smolik, and Delaney Allman. The husband had memory issues and only shared that he and his wife lived alone with their cat, Callie. After 3 days, he was taken to the CVICU and he was able to see his bride. It was then that he stated to Delaney Allman in case management that he needed someone to help Callie. He said his wife would be very upset if something happened to their cat, but he admitted he didn't really care about the cat himself. On the 4th day, Jean reached out to Vicki to request assistance with getting into the patient's home to rescue the cat. Vicki and Delaney reached out to the police department after they learned that the couple had a security alarm that might go off while trying to retrieve Callie the cat. Jean was stressed about that possibility of the alarm going off and police officials arriving on the scene. Thankfully, the alarm had not been set, and Jean did enter safely on the 5th day. This was after days of coordinating with the police and the couple's helpful neighbor. Jean found Callie, who seemed hungry but healthy, sitting in the patient's wheelchair waiting for someone to come home. When Jean approached Callie, she scurried off and hid herself behind a barricade of furniture where Jean couldn't reach her. The neighbor helped move things around so Jean could finally retrieve and safely get Callie. The next day, Jean showed a video of Callie to the patient, proving that Callie was well cared for and healthy. The patient was still very weak, could barely speak and intubated, but her face lit up. Soon after, she began to show signs of improvement. The couple was later discharged from the hospital, and thankfully the cat was reunited with them. This story is a true testament of dedication and commitment to helping patients no matter what. Even 2 of the team members and the patient's husband were not particularly fond of cats. This team looked beyond their personal preferences and was willing to do whatever it took to put the patient first. Their acts of ownership, compassion, and service make Jean, Vicki, and Delaney each a Baptist healthcare legend.
Beverly Cooley joined our Baptist Revenue Cycle team in the midst of our electronic health record transition to Allscripts. Normally, this would be a challenge for anyone, but Beverly immediately entered the role with a calm, sensible, problem solver approach. I noticed her can-do attitude right away. As I got to know Beverly's work ethic even better, I would ask her questions to get to know her personally, and that's why I became truly amazed at the person Beverly is. 5 years ago, Beverly opened up her heart and home to foster children. At the time, she was working in an OBGYN office and heard stories of children in need. As a single woman, Beverly didn't think the foster care system would allow her to help. But she was delighted when she was told yes and could begin her foster parenting journey. Beverly's family was surprised when she first started fostering. Her brother said it was the best decision she had ever made, but her father was skeptical because of long hours she'd spent working for many years. Soon after fostering, though, Beverly's father's concern was gone. Beverly had found her missing puzzle piece. She knew this was God's plan for her. Over 5 years, Beverly fostered 10 children for both short and long-term periods. Things changed forever when she took in a baby girl named Molly. Once Beverly held 8-pound, 2.5-month-old Molly, her mind was set. They were a family. Beverly learned that Molly had an older brother named Cody living nearby. She offered to care for him too so the siblings could stay together. Beverly was granted custody of him. Then nearly 2 years later, The mother of these siblings had another child who needed a home. Again, Beverly stepped up, taking in her second son, Bryson, as an infant. Together, this trio brings her so much joy, along with her 15-year-old bonus daughter, Kaylee, who Beverly helps care for along with her boyfriend. Even while taking in a newborn and going through the adoption process for these kids, Beverly never missed a day of work. She has gone through a roller coaster of emotions, constant court dates, and stacks of adoption papers. Yet she always remains positive and very committed to her role. Beverly was named the 2019 Foster Parent of the Year by the One More Child organization. She credits her mom for helping and supporting her to care for these children. Beverly can always be found helping others with a loving heart. Her motto is that God has her right where He wants her to be and gives her everything she needs to be a mom. Her ownership, integrity, and compassion show in all she does and make her a Baptist healthcare legend.
In life, sometimes we encounter devastating moments, and when those occur, we can only hope that someone will be by our side to support us and help us in our time of need. Jennifer Sariba was that person for former Baptist team member, Latasha. Latasha was almost 19 weeks pregnant when her cervix dilated. This resulted in Latasha having her daughter Sanaya as a stillborn. When Latasha arrived to the local hospital to receive treatment, she was not met with compassion or comfort. Instead, Latasha felt like a number. She was told that her 1-year-old son could not be in the room when she delivered, so her husband would have to wait outside with her son unless someone could come be with him. Latasha felt afraid and alone. She frantically began reaching out to her fellow Baptist team members and work family to see if they could come be with her during this time. Latasha's husband was active duty in the Navy and they had no local family here. Jennifer was about to leave work when she received Latasha's call. She immediately left and drove 20 minutes to where Latasha was located. Jennifer served as Latasha's advocate, staying with her for almost 6 hours while she labored. Latasha and her husband were both in shock and still trying to process everything happening. Jennifer supported them emotionally during every breakdown. When the hospital nurse asked Latasha about burial arrangements for her baby, Jennifer let the nurse know that Latasha was not ready to discuss that yet and would take things one step at a time. Jennifer asked questions to the care team and helped explain what Latasha would be facing for every moment she experienced. In addition to Jennifer's support, Latasha's Baptist family helped her get through the next several weeks. They brought her meals, cards, a basket full of goodies, along with countless hugs and words of encouragement. Latasha felt so blessed and honored that so many people from her work family took the time to be there at her lowest moments in life. Latasha wrote a letter to senior leaders at Baptist to express her sincere thanks to everyone who touched her heart and helped her through this difficult time. Latasha says Jennifer and others at Baptist truly live the mission of helping people throughout life's journey in the work setting and in the community. Latasha has since moved to Maryland, but she still stays in touch with Jennifer and her previous work family. Jennifer was there on Latasha's darkest day, and she's here every day since then, living the values of compassion, excellence, and service, making Jennifer a Baptist healthcare legend.
People transition out of mental health treatment facilities and go back into the community, often feeling nervous, scared, and overwhelmed. Marissa Lopez and Britt McCardle meet with people who are looking for a second chance in life. They worked with someone who was given the opportunity to be on her own for the first time in years. She was receiving involuntary mental health treatment at West Florida Community Care Center. The woman was a spunky senior who joked with Marissa that she wanted to hire an interior decorator to arrange her new home. Marissa took her seriously and became that decorator. Marissa recognized that the woman was worried and needed a trusted person to put personal touches in her new space. Marissa knew that this would help her feel more confident, comfortable, and recruited Britt to help her. Britt and Marissa went shopping for decorations and furnishings. They helped purchase everything from lamps to pictures and much more. Marissa worked with a local thrift store to obtain a larger piece like a bed. She arranged for the furniture to be delivered, and they found accents of pink and white, just like the woman wanted. Down to the last detail, Marissa and Britt arranged photos on the wall, placed towels in the bathroom, and put pillows on the sofa, pouring great care and purpose into every touch. They thoughtfully chose warm and soothing colors so the woman could truly relax in her new space. They helped turn her room at an assisted living facility into a cute and cozy apartment. They felt strongly it would place her in the right mindset to start her new life. The woman became overjoyed and cried happy tears at the first sight of her new home. Marissa received many hugs. After completing the apartment upgrade, Marissa and Britt later refreshed our center's conference room to make it into a brighter and more welcoming space. Marissa and Britt are incredibly passionate about serving others. They consider it their calling and find meaning in being kind, respectful, and open to everyone, especially those with life difficulties and mental health challenges. They go out of their way for everyone at our center and anyone that they meet. They truly live the values of ownership, compassion, and service while embracing our mission of helping people throughout life's journey. That is why they are each a Baptist Healthcare legend.
Birthdays are for celebrating and being a little spoiled by friends and family. Miss Betty was a frequent patient of ours at Gulf Breeze Hospital. During an appointment with Cheri Eman, Miss Betty shared that it was her birthday. Through conversation, Cheri learned that Miss Betty would be returning home to no celebration after the visit. Cheri was immediately compelled to do something for her. Cheri and Betty formed a special bond over a period of time. Miss Betty had to visit our imaging department frequently for treatment. She could be challenging for some members, but Cheri adored her and they got along well. After Cheri learned it was Miss Betty's birthday, she acted with her heart. Cheri called Miss Betty's husband to get her address and permission to make a visit to their home. Cheri checked her 11-year-old son out of school so they could go pick out a birthday cake and balloons for Miss Betty. Cheri took this teaching opportunity to show her son the importance of remembering and caring for others. They showed up at Miss Betty's doors to surprise her. Cheri never saw Miss Betty's face light up with joy like that before. Her son and Miss Betty spent hours outside playing with her chickens in her yard. It was a memorable day for all of them. As Miss Betty's health declined and it became difficult for her to come to our hospital for her procedures, Cheri visited her at home and made sure that Miss Betty's visits required no waiting. Miss Betty later passed away. Her husband wrote a letter of appreciation thanking Cheri for how she had cared for Miss Betty. Cheri shows this kind of dedication and thoughtfulness to every patient in our department that she encounters. She empathizes with each one, she cries with them, and celebrates with them. Cheri understands her feelings, especially since she has been through her own life-changing health journey. Cheri was diagnosed with triple-negative breast cancer in 2012 at the age of 31. Cheri went through her own uncertain, dark path. Thankfully, she has come out the other side cancer-free for almost 8 years now. She's more hopeful and has a new appreciation of life. She wasn't sure that she could have children after what she went through, but Cheri has since been blessed with 2 more beautiful sons thanks to a fertility clinical trial. She believes that God is using her to do His work. What she has gone through has helped her put patients at ease in whatever they face when they come in. Her ownership, compassion, and service make her a trusted partner and friend to others, including me. And that's why Cheri is a Baptist Healthcare legend.